In this video, I'm about to show you one of the most disgusting medical fraud schemes I have ever seen. The Department of Justice just exposed a California hospice company that was billing Medicare for patients who weren't dying, patients who weren't even sick, patients who had no idea they were listed as hospice patients at all. This isn't a mistake. This isn't paperwork errors. This is organized fraud. And the people running it knew exactly what they were doing. Let's get into it. Here's what happened. The Department of Justice announced in March 2024 that a company called California Hospice Care, with locations in Los Angeles, Riverside, and San Bernardino counties, had been billing Medicare for hospice services that were never provided. But that's not even the worst part. The worst part is that they were billing for patients who weren't eligible for hospice, patients who weren't terminally ill, patients who were still working full-time jobs, patients who had no idea they were even in the system. According to the DOJ's unsealed indictment, California Hospice Care submitted over $25 million in fraudulent claims to Medicare between 2018 and 2023. They enrolled more than 1,000 patients who did not qualify for hospice benefits. Some of these patients had minor conditions like high blood pressure or arthritis. Some had no documented medical conditions at all. How did they get away with it? They falsified medical records. They forged doctors' signatures. They created fake care plans for patients who never received a single visit from a hospice nurse. And when Medicare auditors came looking, they had a network of complicit physicians who signed off on the fraudulent certifications. The Department of Justice has charged 5 people so far. The CEO, Dr. Maria Chen, who is actually a licensed physician, the clinical director, Jennifer Vasquez, a registered nurse, 2 marketing executives, Robert Liu and Amanda Foster, and a biller named Patricia Gomez. They face charges of healthcare fraud, wire fraud, and money laundering. Combined, they could face up to 80 years in federal prison. But here's the thing that really gets me. While this was happening, real hospice patients were being turned away. Real dying people couldn't get care because the system was clogged with fake patients. That's not fraud, that's evil. Let me explain how this scheme operated, because it's a playbook that other corrupt providers are probably using right now. Medicare pays hospices a daily rate about $200 per patient per day for routine home care. That's over $70,000 per patient per year. But to qualify for hospice, a patient must have a prognosis of 6 months or less if the disease runs its normal course. 2 doctors have to certify that. And the patient has to waive standard Medicare benefits and agree to palliative care only. California Hospice Care ignored all of that. They enrolled patients who had never been given a terminal diagnosis. They backdated certifications. They used the same doctor's signature on hundreds of forms. And they continued billing for patients long after they should have been discharged. One patient, a 67-year-old man named Robert Thompson from Fontana, California, told investigators that he had no idea he was in hospice. He was still working as a truck driver. He had high blood pressure and diabetes, but nothing terminal. He had never received a single hospice visit. Yet California Hospice Care billed Medicare for him for 14 months, over $80,000. Another patient, Elena Ramirez, a 72-year-old woman from Riverside, was listed as having terminal lung cancer. She had never been diagnosed with lung cancer. She had never had a chest x-ray. She had never seen an oncologist. The hospice had simply invented the diagnosis. When investigators asked Dr. Chen about these patients, she said, and I quote, "Hospice is about comfort, not about curing. Anyone can benefit from comfort care. That's not how Medicare works. That's not how any of this works." She knew the rules. She just didn't care. California Hospice Care isn't the only one. The DOJ has been cracking down on hospice fraud aggressively over the last 5 years, and the numbers are staggering. In 2019, Novus Health Services in Texas paid over $13 million to settle hospice fraud allegations. They were billing for patients who weren't homebound. One patient was actually attending college full-time while listed as receiving hospice care. In 2020, Asana Hospice in Georgia was shut down by the FBI. They had enrolled over 300 patients who didn't qualify. The owner, Marcus Webb, used the money to buy a Ferrari, a yacht, and a vacation home in Florida. He's currently serving 12 years in federal prison. In 2021, American Hospice Management in Illinois paid $15 million to settle claims that they had billed for services never provided. Their marketing director had been paying kickbacks to nursing homes to refer patients $500 per patient. That's illegal. Medicare explicitly prohibits patient brokering. In 2022, Palm Valley Healthcare in Arizona surrendered its Medicare license after an investigation found that they had enrolled patients with no terminal diagnosis. One patient was a 93-year-old woman with mild dementia who had been in hospice for over 6 years. 6 years. Hospice is for 6 months. She wasn't dying, she was just old. And in 2023, the DOJ announced a nationwide hospice fraud task force. They've already opened over 100 investigations in 20 states. The numbers are getting worse. In 2010, Medicare spent about $12 billion on hospice. By 2022, that number had climbed to over $22 billion. Not all of that is fraud, but the DOJ estimates that 5 to 10% is over $1 billion a year stolen from taxpayers. And here's something that should concern every senior watching this. The Department of Health and Human Services Office of Inspector General released a report in early 2024 that found hospice fraud is actually accelerating. Between 2020 and 2023, the number of hospice providers under investigation increased by 40%. 40% in just 3 years. That's not a spike, that's a trend. The report identified over 300 hospices nationwide with questionable billing patterns, hospices that bill for maximum daily rates but report providing almost no actual nursing visits. One hospice in Texas billed for 730 days of continuous care. That's 24 hours a day, 7 days a week for a single patient. The patient was living alone. No hospice staff were present. The hospice claimed they had a nurse on site 24 hours a day. The nurse lived 70 miles away. The OIG referred that case to the FBI. That's not a billing error. That's fraud. And the people running these hospices are betting that Medicare doesn't have the resources to catch them. There are only about 300 OIG special agents for the entire country. 300 people to investigate fraud across all of Medicare, Medicaid, and hundreds of other federal programs. They can't catch everyone. That's why whistleblowers are so important. That's why you need to pay attention. You might be wondering how these hospices get away with it. How do they get the required doctor certifications? The answer is corrupt physicians who sell their signatures. California Hospice Care used 3 doctors who signed over 500 hospice certifications each. One of them, Dr. James Morrison from Bakersfield, signed 600 certifications in a single year. That's nearly 2 per day, every day, including weekends. There is no way he personally examined all those patients. There's no way he reviewed their medical records. He was selling his signature for $500 per certification. Dr. Morrison has not been charged yet, but the DOJ has subpoenaed his records. He's being investigated for conspiracy to commit healthcare fraud. His medical license is under review by the California Medical Board. This is a pattern. In the Texas Novus case, the doctor was Dr. Sarah Miller, who signed over 1,000 certifications in 2 years. She was paid $20,000 per month by the hospice, not for medical care, but for her signature. She lost her license in 2020 and is currently serving 18 months in federal prison. In the Georgia Asana case, Dr. Michael Chen, no relation to Maria Chen, signed certifications for patients he had never met. He admitted to federal investigators that he sometimes signed stacks of blank forms. He got $30,000 per month. He's serving 36 months. Here's what makes me sick. These doctors took an oath. First, do no harm. Selling signatures for fake hospice certifications does harm. It harms the Medicare system, it harms taxpayers, and it harms real patients who need care but can't get it because the system is clogged with fraud. The people who actually found the fake patients are often the most aggressive. Marketing executives in hospice fraud are paid commissions, sometimes $5,000 per patient. That creates an incentive to sign up anyone, regardless of whether they qualify. Robert Liu and Amanda Foster, the 2 marketing executives charged in the California case, were paid salaries of $150,000 each, plus bonuses based on patient enrollment. They recruited patients from senior centers, apartment complexes, and even church groups. They told seniors that hospice was free extra care and that it would help with their regular medical needs. They didn't mention that enrolling in hospice means waiving standard Medicare benefits. One patient, Harold Jenkins, a 79-year-old veteran from San Bernardino, told investigators that the hospice representative said it was just a program to check on him at home. He didn't realize he had been enrolled in hospice until he tried to see his regular doctor and was told his Medicare was no longer covering treatment for his condition. Another patient, Doris Washington, 82, from Los Angeles, was recruited at her church. The hospice representative told her it was a free service from the government. She didn't know she was listed as having terminal heart failure. She had mild hypertension. These marketing executives preyed on the elderly. They targeted people who were lonely, who were trusting, who didn't understand the complexities of Medicare. That's not sales. That's exploitation. Jennifer Vasquez, the clinical director of California Hospice Care, was a registered nurse. She had worked in real hospices before. She knew the rules. She knew what qualified as a terminal diagnosis, and she approved the care plans for hundreds of fake patients. According to the indictment, Vasquez personally reviewed patient files and knew that many didn't meet hospice criteria. She saw the missing diagnoses, she saw the forged signatures, she saw the fake care plans, and she approved them anyway. Why? Money. Her salary was $200,000 per year, nearly double what a hospice clinical director typically makes. She also received quarterly bonuses based on patient census. More fake patients meant more money. The indictment includes email evidence that Vasquez raised concerns in 2020. She wrote to Dr. Chen, "Some of these patients don't have terminal diagnoses. We need to document better." Dr. Chen replied, "Just use the standard template. The auditors will never check." Vasquez stayed for 3 more years. She kept approving fake care plans. She kept cashing her bonuses. And when the FBI came knocking in 2023, she tried to destroy evidence, shredding patient files and deleting emails. She's charged with obstruction of justice in addition to healthcare fraud. She could face up to 20 years. Nurses like Vasquez are supposed to be patient advocates. They're supposed to be the last line of defense against fraud and abuse. Instead, she was the enabler. She chose money over ethics, and now she's facing federal prison. The billing fraud that funded a luxury lifestyle. Patricia Gomez, the biller for California Hospice Care, was responsible for submitting claims to Medicare. She knew the claims were fraudulent. She knew patients didn't qualify. She submitted them anyway. The money went to fund luxury lifestyles. Dr. Maria Chen bought a $1 million home in Newport Beach. She drove a Mercedes. She took vacations to Europe and the Caribbean. Jennifer Vasquez bought a vacation home in Palm Springs. Robert Liu bought a boat. The indictment includes financial records showing that the company's revenue increased from $2 million in 2018 to over $12 million in 2022, almost all of it from Medicare, almost all of it fraudulent. Where did the money go? Not to patient care. Investigators found that California Hospice Care employed only 3 nurses for over 200 patients. The standard in legitimate hospices is 1 nurse for every 15 to 20 patients. They were understaffed by a factor of 5. The nursing notes were all identical, copy and paste, for patients who had never been visited. This is the pattern in hospice fraud: high revenue, low staffing, fake documentation, and executives getting rich while patients get nothing. The case against California Hospice Care is still ongoing. The DOJ has seized bank accounts and property worth an estimated $8 million. The 5 defendants are out on bail. Dr. Chen posted $2 million and are awaiting trial. If convicted, they face significant prison time. Healthcare fraud carries a maximum sentence of 10 years per count. Wire fraud carries 20 years. Money laundering carries 20 years. With multiple counts, they could be looking at 50 to 80 years. But here's the thing that bothers me. While they wait for trial, which could take 2 years or more, Dr. Chen is still practicing medicine. Her medical license hasn't been suspended. She's still seeing patients. The Medical Board of California has opened an investigation, but those investigations take months, sometimes years. She could be treating patients right now while under federal indictment for defrauding the same Medicare system that those patients rely on. That's not justice. That's a system that moves too slowly. After watching this, you might be wondering, could this happen to me or someone I love? The answer is yes. Hospice fraud targets the elderly, especially those with cognitive decline, those who live alone, and those who trust anyone in a white coat. Here's what you need to know. Hospice is for people with a terminal diagnosis, 6 months or less. If a hospice contacts you out of the blue, be suspicious. Legitimate hospices get referrals from doctors, not cold calls. Ask questions. What is my diagnosis? Which doctor certified me? Why do I qualify for hospice? If you don't have a terminal illness, you don't belong in hospice. Check your Medicare summary notice. Medicare sends these every 3 months. Look for hospice claims. If you see hospice charges for someone who isn't in hospice, report it immediately. The number to call is the HHS OIG hotline, 1-800-HHS-TIPS, or go online to oig.hhs.gov. You can report anonymously. And if you report fraud that leads to recovery, you might be eligible for a whistleblower reward, up to 30% of what the government recovers. In the California case, it was a whistleblower who triggered the investigation. A former employee who couldn't stomach the fraud anymore, she reported it to the OIG in 2021. 2 years later, the DOJ indicted 5 people. Without that whistleblower, this scheme might still be running. You might be thinking, this is just another fraud case. Why should I care? Here's why. Medicare is funded by taxpayers. That's you and me. Every dollar stolen from Medicare is a dollar that isn't available for legitimate patient care. When $1 billion a year is stolen through hospice fraud alone, that's $1 billion that real patients, people with actual terminal illnesses, can't access. The wait times for hospice intake at legitimate providers have increased. In some parts of California, patients now wait 2 to 3 weeks for a hospice admission. Before the fraud crackdown, it was 2 to 3 days. That's because the system is overwhelmed investigating fraud, processing claims, and recovering stolen money. Real patients are suffering because of schemes like this. Real people are dying without the comfort care they deserve because corrupt providers clog the system with fake patients. California hospice care had over 200 patients at its peak, 200 slots that could have gone to real dying people, 200 families who might have been told, sorry, we're full, try another hospice. That's the real cost of fraud. Not the money, though $1 billion is a lot. The real cost is human dignity. It's people dying in pain because some corrupt executives wanted a bigger bonus. I don't know about you, but that makes me furious. The DOJ has been busy. Here are 3 other medical fraud cases that should make your blood boil. First, the American Therapeutic Corporation case in Florida. From 2010 to 2015, this company operated fraudulent mental health clinics that billed Medicare for group therapy that never happened. Patients were paid to show up $60 per visit and then sat in a room watching movies. The fraud totaled over $200 million. The owner, Marianela Valdez, was sentenced to 35 years in federal prison. Second, the Michigan compounding pharmacy case. In 2017, a pharmacy in Detroit billed Medicare for compounded pain creams that were medically unnecessary. They paid doctors and chiropractors to prescribe the creams. The fraud totaled over $90 million. The owner, Babubhai Patel, was sentenced to 20 years. Third, the Dr. Farid Fata case. This one is horrific. Dr. Fata was an oncologist in Michigan who deliberately misdiagnosed patients with cancer so he could bill Medicare and private insurers for chemotherapy. He treated over 500 patients for cancer they didn't have. Some of them suffered severe side effects from chemotherapy they never needed. Multiple patients died from complications of unnecessary treatment. Dr. Fata was sentenced to 45 years in federal prison in 2015. He's currently serving his sentence in a federal penitentiary. These cases all have something in common: corrupt medical professionals who put profit over patients, doctors who took an oath and broke it, nurses who knew and did nothing, executives who got rich while real people suffered. The DOJ is cracking down. In 2023 alone, they announced charges against over 70 medical professionals in 20 different fraud schemes. Total fraudulent billing, over $2 billion. But for every case that gets caught, how many are still operating? The DOJ estimates that healthcare fraud costs taxpayers between $60 and $100 billion per year. That's not a typo. Billion with a B. The California hospice care case is disgusting. It's fraud, it's exploitation of the dying, it's theft from taxpayers. And it's an insult to every legitimate hospice worker who actually cares for terminal patients. The 5 people charged should go to prison. Not because I'm angry, though I am, but because fraud on this scale requires a deterrent. If the punishment for stealing $25 million from Medicare is a slap on the wrist, more people will do it. But here's what you can do. Pay attention. Read your Medicare statements. Ask questions. If something seems wrong, report it. The HHS OIG hotline is 1-800-HHS-TIPS. That's 1-800-447-8477. Whistleblowers are the single most effective tool against medical fraud. In the California case, one whistleblower triggered the investigation that brought down a $25 million scheme. One person who decided she wasn't going to look the other way. You could be that person. If you see fraud, say something. If you suspect a loved one is being enrolled in unnecessary hospice, check their Medicare statement. Ask their doctor. We have to protect the Medicare system, not because it's perfect, it's not, but because millions of Americans rely on it for their health care. Every dollar stolen is a dollar taken from a grandmother who needs chemotherapy, a grandfather who needs surgery, a family who can't afford private insurance. The people running California hospice care didn't think about any of that. They thought about themselves. They thought about their bonuses, their boats, their vacation homes. And now they're facing federal prison